Hi, welcome to the Body Shop Physical Therapy. My name is Catherine Price. I'm a physical therapist. Today I'm going to go over a rehab routine to address spondylolisthesis in the lumbar spine or in the low back. So this can result or cause low back pain as well as pain down the legs depending on the severity of the spondylolisthesis. Before I begin, I'm going to speak a word of life from Psalm 34:14. Turn from evil and do good, seek peace and pursue it. So what is spondylolisthesis? So we have 5 stacked vertebrae in the lumbar spine, and it's positioned in a curve. There should be a natural lumbar curve that's lordotic, which it's going to be sway back, but you don't want to be overly swayed back. You just want a normal lumbar curve. And with spondylolisthesis, what happens is one of the vertebrae is going to slip forward, and so that is going to be abnormally positioned, and it's graded by how much the vertebrae is slipped over top of the vertebrae underneath it, and depending on the severity of it can also depend on the symptoms. So if it's slipped forward far enough, it can end up hitting the nerve roots that come out of the spine, and you can end up with pain that radiates out into the hips and into the legs. So what we want to do is use our muscles. So if we've got one vertebrae that's slipped forward, we can use the abdominal muscle to pull that vertebrae back in order to stack the spine and create a better position of the vertebrae to alleviate pain and symptoms. So if you arch your back or you bend backwards and you get radiating pain down the legs or pain in the back, that can be indicative of spondylolisthesis. You can determine if you have a spondylolisthesis on an x-ray radiograph. So you do want to consult your medical doctor or physical therapist for the appropriateness of exercises for you, and you do want to know what you're dealing with and the source of your back pain before beginning any program. So this is going to be a program that I've used in a later advanced stage after working early on with the abdominal. So this is going to be a rehab routine that can effectively address that spondylolisthesis and help to conservatively manage that and alleviate symptoms if possible. So I'm going to take you through this series of 9 exercises, and I am going to use some different exercise equipment. You can use a chair. I am going to use a therapy ball. This is a Pilates ring. You can use anything that you can place between your knees for resistance. So you can use a pillow or an inflated ball or even a basketball. But I'm going to use a Pilates ring to give some resistance there. I then have 2 blocks, and you can just use stacked books, or you'll see that you can find something that just elevate the feet that will work just fine. But I'm going to use 2 blocks. I'm going to use a looped TheraBand, and then I have a towel that I'll be using. So the first exercise, we're going to use the abdominals. Again, our vertebrae is slipped forward. We want to pull it back using the abdominal muscles. So the first exercise I'm going to do are going to be sit-ups, but in a 90-90 position. So I'm going to use the ball and place it behind my thighs and let my hips and knees bend as much to a 90-90 position as I can. So what I want to do is I want to get out of that forward tilt and keep my hips back. So I want to engage the abdominals, brace my core, and have my back contacting the floor. And so I am going to use my rectus abdominal muscles and my lower abdominal muscles to do a sit-up. I can put my arms out in front, or I can place them behind my head and support my head and neck. So the first thing I want to do is draw my navel into my spine. I want to hold my back against the floor, make sure I'm contacted, and then I'm going to lift up and come right back down. I'll do that 25 times. 2, down, 3, down, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, and then relax. Make sure that the back stays contacted on the floor the whole time. If you've got that spondylolisthesis, you're going to want to end up staying arched and lift without contacting, so it's important to keep the back down. I'm going to do another set of 25. Navel comes to my spine, back is contacted on the floor, and 25. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. So 2 sets of 25 crunches in a 90-90 position. Then I'm going to use my Pilates ring, and I'm going to place it between my thigh. I'm going to stay in a hook lying position with my knees bent. And so in this position, I am, as long as I'm not having symptoms, what I'm going to do is if I can get my back down onto the floor, I'll stay in this position. If not, I'm going to go ahead and elevate my feet up on the blocks. But here I'm just going to activate my adductor so I have the ring between my thighs. And then I'm going to press, I'm going to first navel to my spine, back contacted on the floor, and then I'm going to squeeze my knees in and then bring them back out, but keep pressure the whole time. So 2, and I'm going to do this 25 times. 3, and bring it out, but keeping my navel to my spine. 4, back out. 5, back out. 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, and 25. So when you squeeze in, you may feel that the hips want to shift forward. So that iliacus muscle, when it's tight, it's that hip flexor pulls forward. So we want to keep that posterior pelvic tilt, the abdominals contracted, and then activate the adductors and even engage that iliacus so that we can retrain that hip flexor from being contracted in that forward tilt. So I'm back and then pressing in. Next, I'm going to then elevate my feet on my blocks. So this is just to get me into that posterior pelvic tilt so that I can take that vertebrae and we're shifting it back in a correct position. So what I'm going to do is then I have my feet elevated on the block. And the reason I'm going to have them elevated is so that I do not arch my back when I come all the way to the floor. So I'm going to keep my back contact on the floor. And then I'm going to hold my adductor, so I'm going to hold the pressure and squeeze this Pilates ring. You can squeeze a basketball, squeeze a pillow, but I'm just going to put pressure, hold in, and then keep my back down, and then lift both knees up to my waist and bring it right back down, and touch up and come right back down. And I'm going to do this 25 times. So I'm squeezing in and then lifting. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, and then relax. Now, to further engage my core, I'm then going to take the towel. I'm going to do another set of 25, keeping my feet on the block. I'm in a posterior pelvic tilt. I'm then going to engage and depress my shoulders down. The shoulder blades are also part of the core. So I'm going to hold and anchor my shoulders down, pushing the towel apart to help me anchor down So I'm going to then be engaging my core from the rectus abdominis higher up, keeping that posterior pelvic tilt back on the floor, and then I'm going to lift 25 more. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. All right, I'm going to take the Pilates ring, bring it down, and then I'm going to keep my feet on the block if I need that posterior tilt. If I don't, I can bring them down. So I'm going to keep my towel. I'm then going to, same thing, engage, keeping my shoulder blades anchored down. But when I anchor down, I don't want to arch. I'm just anchoring from the shoulder blades, but still keeping that posterior pelvic tilt. My back is to the floor. I'm going to lift my knees up and then straighten and hold for a count of 5. 1, 2, 3, 4, 5, and then relax. And I can even rest the shoulder blades. I'm going to engage my core and then point, 2, 3, 4, 5, and relax. I'm going to do 20 of these. And 3, 2, 3, 4, 5, relax. 4, 2, 3, 4, 5, relax. 5, 2, 3, 4, 5, relax. 6, 2, 3, 4, 5, relax. 7, 2, 3, 4, 5, relax. 8, 2, 3, 4, 5, relax. 9, 2, 3, 4, 5, relax. And I'm pushing the towel apart. 10, 2, 3, 4, 5, relax. 11, 2, 3, 4, 5, relax. 12, 2, 3, 4, 5, relax. 13, 2, 3, 4, 5, relax. And I'm not fully resting my abdominals as I'm doing this. 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. 5 more. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. 3 more. 1, 2, 3, 4, 5, relax. Shoulders down and back, pressing the towel apart, tighten the thighs. 1, 2, 3, 4, 5, relax. And pressing the towel apart, shoulders down and back, tighten the thighs. You should feel the back press down into the floor, posterior pelvic tilt, feeling the core working, especially in the abdominal region. And relax. So that is going to be the core using that posterior pelvic tilt and my shoulder blades as well as my lower abdominals. Then I'm going to go into a plank, but this can actually bring on symptoms if not done correctly. I'm going to squeeze my buttocks just as tight as I can, and then I am going to, so I'm first going to do a butt squeeze, so I'm going to tilt my hips backwards and then lift up, and I'm going to hold for a count of 30. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And then I'm going to sit back, just take a quick rest. And it's important to squeeze your butt the whole time. If you let the butt go, it puts a lot of stress on the lower lumbar spine. So I want to keep that posterior pelvic tilt. I want to tighten my abdominals, so I'm going to squeeze my butt. You can see that my back is going to be rounded slightly. I'm going to keep my butt tightly squozen and then contract my lower abdominals and hold for a count of 30. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and relax. Next, I'm then going to do a side plank with a posterior pelvic tilt. So, same thing, if you do not have that tight butt squeeze, then it is going to not allow that vertebrae and that hips to come back. So I want to make sure that I'm engaging my lower abdominals. I'm going to go up into a side plank, but I'm going to make sure that I'm keeping a tight butt squeeze when I do this, and hold for 30 counts. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And I'm going to do this twice on both sides, stacking. You want the elbow directly under the shoulder. You do not want to hurt the shoulder. I'm going to come up, but I'm going to squeeze my butt really tight, and I'm going to tilt my hips backwards and hold this position 30 seconds. 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Switching. One more each side, making sure that I squeeze my buttocks tightly, going up onto my side, tilting my hips backwards, and holding this. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Last time on the other side, making sure you squeeze your butt, posterior pelvic tilt, and engaging those lower abdominals, holding this. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, and 30. Then, if you've got tight heel cords or even have a history of Achilles tendonitis or stiffness in the ankles, so it will pull you into a lordosis. So we're going to stretch the whole back line. To do this, I am going to do a downward facing dog, or I'm going to do a back line stretch. My heels are going to be down onto the floor. I want to push through the heel of my hands, and I really want to focus on stretching the calf region and the back side. So if my back is arched, this is probably not going to be a good place to start, but if I can do this without having any symptoms or pain, I'm going to stretch the back line and hold that for 30 seconds. Taking deep breaths, we'll do 10 more seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1, and then I'm going to come down and stretch my back and allowing my head to rest down. This is going to open up the back. So a spondylolisthesis is a closing problem, so we want to open up the joint, open up the back. So I'll hold this for 30 seconds and then go back into that downward facing dog. Go back and forth between stretching the back to stretching the back line into the heels 3 times. So pushing down and holding, taking deep breaths in. Tightening the thighs. Ten more seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1. Coming down, untucking the toes, sitting back, stretching out the back. Deep breaths in, all the way out. And last time, alternating back and forth, heels go down, tightening the thighs, pushing through the heel of the hands, getting a good stretch on the back of the leg. Do not do this if you're having any pain in the back or down the legs that's other than a stretch. So I'm just looking for a stretch. And last time, just coming down and sitting back onto my heels, dropping my forehead down and stretching the back. Deep breath in, all the way out. Deep breath in, and all the way out. And the last thing, I'm then going to use my loops. So what we worked on is the abdominal and the core muscles, the posterior pelvic tilt, trying to bring that vertebrae back over the bottom so that we're stacking the vertebrae. And one of the biggest stabilizers of the back are going to be the glutes. And so what I'm going to do next, I'm going to use my band and I'm going to do monster walks with the posterior pelvic tilt. So I'm going to get into that position. I'm going to tilt my hips backwards. So slight bend in your knee, posterior pelvic tilt, and I'm going to do steps back and forth. 4, 5, and to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 to the right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 to the left. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and to the right. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10. So I'm going to do 2 sets, 4 sets of 10 total, but 2 sets each direction of the monster walks with that posterior pelvic tilt. So when I'm standing on my side, I'm going to tilt my hips posterior and then engage the glutes as I'm stepping. So with a spondylolisthesis, you have a tilt forward. We want to get out of that, bring that back, hold here, and side step. So those are going to be some advanced exercises in a rehab program, and they're great maintenance exercises to continue to address a lumbar spondylolisthesis, to get the vertebrae in better position, to alleviate back pain as well as symptoms down the leg, and over time progress and hopefully change that positioning so that you can manage the low back. I hope this is of help and have a blessed day. Thank you.